11 ways to prevent coronary artery disease. What is coronary artery disease? Coronary artery disease, CAD, also known as coronary heart disease, CHD, occurs when blood flow through the coronary arteries is reduced. These arteries supply oxygen-rich blood to the heart muscle, and when they narrow, the heart receives less of the blood it needs to function. In the United States alone, about 16.5 million adults over the age of 20 are affected by coronary artery disease. One of the major contributors is high cholesterol, particularly elevated levels of low-density lipoprotein, LDL, often called bad cholesterol. What causes coronary artery disease? The primary cause of CAD is the buildup of plaque inside the artery walls. Plaque is made up of cholesterol, fatty substances, and other materials. Over time, this buildup hardens and narrows the arteries, a condition known as atherosclerosis. When arteries are narrowed, less blood can reach the heart muscle, putting you at risk of serious complications. Risk factors for coronary artery disease. Certain factors increase your likelihood of developing CAD. You are more at risk if you have a family history of heart disease, are overweight or obese, consume a diet high in saturated fats, trans fats, sugar, or salt, have high levels of LDL cholesterol or low levels of high-density lipoprotein, HDL, cholesterol, smoke tobacco, led a sedentary lifestyle, have uncontrolled high blood pressure, live with diabetes. The risks of living with coronary artery disease. The heart muscle requires a consistent supply of blood to pump effectively. When blood flow is restricted, it can lead to chest pain, also known as angina. In more severe cases, a complete blockage in one or more coronary arteries can trigger a heart attack. Without enough blood, parts of the heart muscle begin to die, resulting in permanent heart damage or even death. How to prevent coronary artery disease naturally. Small but consistent changes in your daily routine can significantly lower your risk and protect your arteries. Here are 8 lifestyle habits that play a key role in preventing coronary artery disease. 1. Eat a heart-healthy diet. Nutrition is one of the most powerful tools to prevent coronary artery disease. Choose foods that support cardiovascular health, such as fresh fruits and vegetables, whole grains, lean protein sources like poultry and fish, nuts and seeds, olive oil and other healthy fats. At the same time, reduce or avoid foods that promote plaque buildup, including fried foods, sweets, red and processed meats, and full-fat dairy products. Limit sodium intake to less than 1 teaspoon per day, as excess salt can raise blood pressure and increase strain on the heart. 2. Stay physically active. Regular physical activity strengthens the heart muscle, helps manage weight, lowers blood pressure, and improves cholesterol levels by boosting protective HDL while reducing LDL. Aim for at least 150 minutes of moderate-intensity aerobic exercise each week, or 75 minutes of vigorous exercise. Walking, swimming, or cycling are excellent options. If you are new to exercise, consult your doctor before starting a new routine. 3. Maintain a healthy weight. Carrying excess weight places additional stress on the heart and blood vessels. Losing even 5 to 10% of body weight can significantly lower LDL cholesterol and blood pressure, reducing your risk of coronary artery disease. If weight loss is difficult, consider professional guidance. Nutritionists and dietitians can provide personalized plans, while health apps such as MyFitnessPal, Lose It, or Fujicate can help track progress and keep you motivated. 4. Quit smoking. Tobacco smoke contains thousands of harmful chemicals that damage the arteries, narrow blood vessels, and increase the risk of heart attack. Quitting smoking is one of the most effective ways to prevent coronary artery disease. While quitting can be challenging, support is available. Your doctor may recommend medications, nicotine replacement therapy, or counseling. Organizations such as the American Lung Association also offer helpful resources for those ready to stop smoking. 5. Manage blood pressure. High blood pressure forces blood against the artery walls with greater intensity, leading to damage and increasing the risk of atherosclerosis. A normal blood pressure reading is around 120/80 mmHg, though your target may differ depending on age and health conditions. If your readings are consistently high, work with your healthcare provider on a plan to bring them down through lifestyle changes, and if necessary, medication. 6. Limit alcohol. While moderate alcohol consumption, such as a glass of red wine, may slightly raise protective HDL cholesterol, drinking too much can harm the heart. Excess alcohol contributes to high blood pressure, weight gain, and even heart failure. If you drink, do so in moderation, up to 1 drink per day for women and up to 2 per day for men. Always check with your doctor to determine whether alcohol is safe for you, as even moderate drinking may not be appropriate for everyone. 7. Keep blood sugar under control. Coronary artery disease is the leading cause of death among people with diabetes. Both conditions share overlapping risk factors, including high blood pressure, obesity, and high LDL cholesterol. Uncontrolled high blood sugar damages arteries over time, accelerating the development of heart disease. People with diabetes are twice as likely to die from heart disease compared with those without diabetes. To prevent coronary artery disease, it is essential to manage blood pressure, cholesterol, and weight. Work closely with your doctor to keep blood sugar within target ranges through a combination of healthy eating, exercise, and medication when necessary. 8. Reduce stress. Chronic stress can elevate blood pressure and harm artery walls, increasing the risk of coronary artery disease. Incorporating regular relaxation techniques into your routine can help manage stress levels. Options include meditation, deep breathing exercises, yoga, or simply listening to calming music while taking a walk. Practicing stress management consistently can protect your heart over the long term. How to prevent coronary artery disease with medication. In some cases, lifestyle changes alone may not be enough to protect the arteries. Doctors may prescribe medications that lower cholesterol, reduce blood pressure, or prevent blood clots. These treatments are often used in combination with healthy lifestyle choices. 1. Cholesterol-lowering medications. Elevated LDL cholesterol accelerates plaque buildup in the arteries. Cholesterol-lowering drugs can reduce LDL, increase HDL, and slow the progression of coronary artery disease. Statins. These block a substance the body uses to produce cholesterol. Common options include atorvastatin, Lipitor, fluvastatin, Lescal XL, levastatin, Alteprev, pitavastatin, Livalo, pravastatin, Pravachol, rosuvastatin, Crestor, and simvastatin, Zocor. Bile acid sequestrants. These medications help the body remove cholesterol from the blood. Examples include cholestyramine, Prevolite, Colcevalum, Welchol, and Colestipol, Colestid. Fibrates. These target triglycerides and raise HDL cholesterol. Options include clofibrate, Atramides, fenofibrate, Tricor, and gemfibrozil, Lopid. Niacin, vitamin B3 available as Niacur and Neospan. Niacin helps raise HDL cholesterol and can be part of a broader treatment plan. 2. Clot-preventing medications. When plaque builds up inside the arteries, it increases the risk of blood clots. These clots can partially or completely block blood flow to the heart, potentially causing a heart attack. Clot-preventing medications make it harder for blood to clot, reducing the risk of coronary artery blockages. Common options include apixaban, Eliquis, aspirin, clopidogrel, Plavix, dabigatran, Pradaxa, edoxaban, Savasa, enoxaparin, Lovenox, rivaroxaban, Xarelto, ticagrelor, Brilinta, ticlopidine, Ticlid, warfarin, Coumadin. Your doctor will recommend the most appropriate drug based on your health status and overall risk profile. 3. Blood pressure-lowering medications. High blood pressure is one of the most significant risk factors for coronary artery disease. Lowering blood pressure protects the arteries from damage and reduces the likelihood of plaque buildup. Several types of medications are commonly prescribed. ACE inhibitors and ARBs. These relax blood vessels to improve blood flow. Examples include enalapril, Vasotec, lisinopril, Prinaval, Zestril, losartan, Cozar, Ramipril, Altase, and valsartan, Diovan. Calcium channel blockers. These prevent calcium from entering heart and blood vessel muscle cells, allowing the arteries to relax. Options include amlodipine, Norvasc, Bepredil, Vascar, Diltiazem, Cardizem, Dilacor XR, Nicardipine, Cardine, Cardine SR, Nifedipine, Adalat CC, Afetitab CR, Procardia, and Verapamil, Calin, Covera HS. Beta blockers. These medications slow the heartbeat and reduce the force of blood flow, easing pressure on the arteries. Examples include atenolol, tenormin, metoprolol, Lopressor, Toprol XL, and Nadolol, Corguard. Takeaway: to prevent coronary artery disease and lower your risk of a heart attack, the first step is understanding your personal risk factors. Talk with your doctor about your weight, blood pressure, cholesterol, blood sugar, and lifestyle habits that may affect your heart health. From there, focus on protective steps. Adopt lifestyle changes such as following a heart-healthy diet, exercising regularly, maintaining a healthy weight, quitting smoking, and managing stress. If lifestyle adjustments are not enough, your doctor may recommend medications to help lower cholesterol, control blood pressure, and prevent blood clots. Preventing coronary artery disease is possible with the right combination of awareness, daily choices, and medical care. Taking action now can protect your heart for years to come. If you found this video helpful, don't forget to like, share, and subscribe to HeInfo, your all-in-one destination for trusted, science-backed health information. Stay informed, stay healthy, and join us as we explore more ways to protect your well-being.